Hi and welcome. I'm Hank Xun, Certified Red Cross First Aider. And in this video we're going to talk about chain of survival and the concept of the precious golden 4 minutes. Chain of survival is a concept that has been introduced by the American Association of Hearts in 1992. It is a useful metaphor for describing the elements in emergency cardiovascular care systems that have outlined key ideas in providing quality basic health supports to patients with cardiac arrest or when their hearts suddenly stop pumping. There's many more other types of chains of survival based on the ages of patients and out or in hospital situations. In this video we'll be focusing on adult out of hospital chain of survival. Let's break it down. First, is the recognition of the cardiac arrest and activation of emergency response systems, which is to say, call for help. When you see someone that is suddenly become unresponsive or short of breath or in some kind of distress or chest pains, don't hesitate to dial the emergency number of your local areas. Every minute matters in such a life-threatening situations. Next is early CPR. CPR is an abbreviation for cardiac, heart, pulmonary, lung, resuscitation, revival, which is all about chest pressing and artificial respiration to restore patients' breath and blood circulations. Sooner bystanders start to perform CPRs to the needed patients, high likelihood of patients to survive through such an incident. Then we have early defibrillations, which is usually done by special medical devices called automatic external defibrillator, or short for AED. This device is about using electric shock to restore a uniform rhythm of heartbeat. AED usually have voice instructional guidances, which makes them more accessible to bystander helpers without medical trainings. We'll have another video especially talk about how to use AED and perform CPR. Following, we have early advanced care, when medical professionals arrive and take over the patients to provide more advanced care with necessary interventions and more accurate evaluation of patient situations. One result of those evaluations could be transport the patient to hospital with more medical devices and equipment and resources compared to the out-hospital situation that we are dealing with. Finally, there's post-cardiac arrest care, necessary to stabilize patients' conditions and restore them to their best conditions when they can leave the hospital. The concept of the golden 4 minute ties in with the previously mentioned early CPR, second step of the chain of survival. This golden 4 minutes, from its name, have identified the most optimal CPR delivery time to be within 4 minutes after the patients get cardiac arrest, with roughly 10% survival rate decrease every minute in delays of CPR. All this goes back into the urgency in providing emergency care to patients with cardiac arrest who are vulnerable to permanent damage to their bodies due to lack of oxygen. Every minute and seconds counts for them. In this video, we have gone through the components of the chain of survival and the importance of the golden 4 minutes. If you're looking for more detailed learning about first aiders, check out the Red Cross or American Heart Association official websites for trainings or learning materials. Thank you. See you next time.